Hello everyone and welcome! Today is a very special day for me because I get to share with you one of the things I've been learning so much about for the past couple of weeks. But before anything else, I'm Kate, I'm a pharma copywriter, and for today's video, we'll be talking about one of the oldest and most recognized components of the marketing mix. I'm talking about personal selling. But before we dive deeper into that, I want you to sit back, relax, and listen closely because we're about to be Prescribing Persuasion, how pharma copywriting is used in personal selling. Out of all the promotion mix strategies, personal selling is the one that connects the seller directly with the consumer and focuses on developing relationships. So if the product is more complicated, more expensive, and can be customized to a customer's needs, personal selling is your best bet. The personal selling process consists of 6 stages: prospecting, pre-approach, approach, presentation, close, and follow-up. This is according to Berkowitz et al. In 1993. According to Firmansyah et al. In 2019, personal selling helps strengthen the relationship with existing customers, preserve, increase, and expand the volume of customer business, and maintain buyer-seller relationships, and at the same time, promote word-of-mouth referrals. This involves direct face-to-face contact, and thus the only promotional tool that can encourage and take advantage of consumer reaction on the spot. While personal selling is a useful tool for healthcare providers to connect with their target market and achieve their communication goals through direct interactions to convey messages effectively. So how do we convey messages in the medical field effectively? With copywriting, of course. Now, pharma copywriting is about creatively and originally communicating the message of a medical product. As a pharma copywriter myself, I usually exercise this strategy through the detailer aids that the clients ask us to produce for a certain product that they either wish to launch for the very first time or relaunch with a new campaign to increase sales. You might be thinking, what are detailer aids? Well, simply put, a DA, what we usually call them, is a marketing tool pharma companies use to educate healthcare professionals about a product. Now, these DAs get passed down to medical representatives or salespeople who personally visit doctors or other medical practitioners to educate them about a product, bringing the presentation stage of personal selling to life. So in writing DAs, I was taught many things about the words to use and words to avoid, essentially the do's and don'ts. And I narrowed them down to 3. Here are the 3 important do's and don'ts of pharmaceutical copywriting. Number 1, do research with scientific proof. Don't research from blogs and deceptive websites. Sometimes clients would already provide the data that they want to see in the DA because it already came from the company's own research. But if they don't provide it, it's always best to research from medical journals or well-known medical websites that are reviewed or authored by healthcare professionals. Never ever quote from a blog without a credible source. Here are some of the medical resources that I would tap into when researching for the info in a DA. Number 2, do limit the need to explain. Don't show lengthy info that they already know about. Pharma copywriters must convince doctors to prescribe a specific brand, usually what they're selling, through acceptable research and data that they may not be aware of just yet. Chop off the lengthy info and just give them the gist. And lastly, number 3, do review the ASC guidelines for product or service claims and special terminologies to avoid. Don't use comparative or superlative claims unless there is substantiation. The golden rule of all in pharma copywriting is never to promise that the drug or service will make the patient's life longer or be in its best state or anything in that sense. Though medicine does intend to make the patient better, pharma DAs should not suggest that unless backed up by data, because according to the guidelines of the ASC, specifically in their code of ethics, products or service claims must always have a retail audit or scientific data, research, certifications, or publish journals that will support said claim. For example, in 2020, the FDA released a public warning against the unapproved and misleading advertisement of food products and supplements claiming to boost the immune system and decrease the risk of COVID-19 infection. Copywriting is one of the strategies that would make any IMC tool effective if you do it right. In personal selling, copywriters create a sense of urgency through persuasive language and effective calls to action. So, to wrap this all up, I'll leave you with 3 key points from today's vlog. I guess that's it for today's vlog. And since I'm all for feedback, if you have any questions, suggestions, or violent reactions, please do comment them down below. Thank you so much for listening, but until then, this has been Kate, and I'll see you guys next time. Bye!